These days, many companies are trying to shed more light on mental health awareness in the workplace. A study from the American Psychological Association found 8 in 10 U.S. workers say whether businesses show support for employees' mental health is a very important factor when considering job opportunities. Joining us now to discuss is clinical psychologist Dr. Gretchen Moran Marsh. Thank you so much for joining us today.
Thank you for having me here today.
So we were just kind of discussing during the commercial break, what is behind this change in tone, this shift in paradigm? We all can speak about mental health a little more openly now. Is it just the pandemic?
I think the pandemic contributed greatly to opening the dialogue and decreasing the stigma of mental health.
Yeah.
You know, pre-pandemic, 1 in 5 had a diagnosable mental health problem. And according to the World Health Organization, that number has increased between 20 and 30%. So we're thinking almost half of the population has a mental health condition, most commonly anxiety or depression-related disorders.
And is that something that was just unrecognized before? It can't be that everyone had an acute experience since the pandemic, right?
Great, yes, you said it exactly. It wasn't, you know, the pandemic contributed to it, but we were seeing increased rates of anxiety and depression pre-pandemic. And then the isolation, you know, we're social beings. We were not meant to live in isolation for a few years. We were in there for over 2 years, I believe. And we were meant to be with other people, and that caused anxiety in the beginning, and then it led to depression. And we saw those two things really skyrocket. We've also seen substance abuse skyrocket.
Yeah. When the pandemic first started, a lot of people were working from home. Even in our industry, I'm a news anchor, and I was broadcasting from home. I remember feeling very isolated, very cut off from everyone at work, kind of unsure, what do they think I'm doing? And you just start to sort of spiral. What is it about being isolated and on your own that just your mind just takes you somewhere you don't want to be?
Well, that's so interesting you say that. So you probably were feeling really anxious, weren't you? And you were home and isolated, and you didn't have the social support of people around you. And you know what happened? Your negative thinking patterns started going out of control, and you couldn't control them.
Right.
You couldn't, you know, bounce off your thoughts from somebody else to say what you were thinking and feeling. And what that happens is when we feel anxious, those negative thoughts spiral out of control, and they go in. You know, you have negative thoughts, and they're automatic, and they don't get anywhere. They don't make you feel any better.
No.
You feel far worse. So we saw that, you know, it affects our minds, our thoughts, and our behaviors, really, all of this isolation. And in fact, you know, the U.S. Surgeon General just declared loneliness an epidemic 2 weeks ago. And we're really seeing that people are experiencing loneliness, and it's as bad for your health as a pack of cigarettes a day. I mean, it's tremendous.
That's incredible to think about. How important is it to have these conversations, to know that what you're experiencing is actually an issue? It's more than just worry, and other people are experiencing the same thing.
Yes, so you mentioned two things. When can I know that I have a problem? And you have a problem when it's interfering with your daily functioning, meaning you're not able to do the things that you used to like to do or that you would like to do. We also see that people who are suffering with mental health conditions have changes in sleep patterns, in eating patterns, in their negative thinking. And really what's happening now is this conversation has started. You know, I'm here today to talk about breaking that stigma that we all have had difficult times in our life emotionally, and what we can do to improve it.
Have you seen that the workplace conversation in particular is picking up? Are people more able to access resources or even discuss if they're in crisis or having an issue with their employer?
Yes, we have many companies in the Metro Detroit area that have really started to address mental health problems. One of them that I work with is Lear Corporation, based in Southfield, and another one is Blue Water Technologies. And we see that they are very interested in improving their employees' mental health. You know, it's so refreshing. It's now we see that companies as big as Lear are not just, you know, supporting the person that comes to work, but the whole person. They're not just interested in the hours that they put in or the work that they do, but how is that person functioning at home? We do care. And so they've been doing a number of different initiatives to improve mental health in the workplace.
And don't the companies themselves stand to benefit from this?
Exactly right. It's a win-win for everybody. So Deloitte did some independent research, and they found that for every dollar an employer invests in mental health, they get a $4 return on increased productivity, decreased absenteeism, decreased, you know, using mental health insurance and stuff like that, decrease turnover. And, you know, you started this segment, the younger population is really expecting it. They expect their employers to take care of their mental health.
Yeah. And what are some of the ways they are doing that? What are the resources they're
Great. So
offering?
one of them is like really strong employee assistance programs. So corporations like Lear and Blue Water and even GE Healthcare, they have a lot where you could go in and see a mental health professional. They also have days off and flexible scheduling. They're considering, what are the needs of our employees? We want to meet them. It's good for them, it's good for us, and it's good for the corporation. Other things is bringing in mental health providers. So it's very interesting. Industrial organizational psychologists have been in the workplace for about 100 years, and they worked on people for selection and placement. But now corporations are bringing in people like me, clinical psychologists, who are experts in mental illness, to say, how can we improve the mental health? Can you teach our employees strategies to improve their mental health?
Yeah.
And so I go in and talk about sleep and exercise and leisure and food and negative thinking. And it's really proven to be very beneficial.
All right, and finally, tonight, what would you say to anyone who's either looking for a job, who's just struggling with their mental health, and they don't really know where to turn?
Yes, so there are great resources. The American Psychological Association, the World Health Organization has a lot of great information how to improve mental health and also how to seek employers that are interested in being supporters of your mental health.
Yeah, there are a lot out there. Well, Dr. Gretchen Moran Marsh, thanks so much for joining us today. We really appreciate your time.
Thank you very much for having me.